My role in transition here at the RVI is I am part of a team that has developed a pathway for transition from patients transitioning from the children's ventilation team up into the adults team. And we've been developing that over the last 3 years to try and improve the process.
In years gone by, it was much more of a transfer of a care than transition of care. So it would often just be that when you turn 17, the paediatric team would contact the adult team, say they're ready for you to take over their care, and the patient would be handed over. And that was really difficult for patients and families. They had a very well-established relationship with paediatrics. As many of these patients will have known their paediatric respiratory specialist for their entire life, and the same for the families. So actually we found over time, by doing it as a very slow process over kind of 2 years with multiple joint appointments, that really gets the patients and the families to understand how the adult service works, to understand who's within the adult service, get a little bit of confidence in the adult team as well. And it gives us the opportunity also to get to know the patients better, understand what the current healthcare problems are, and to understand decisions that have been made more recently around their kind of ventilation, for example.
I started the process of transitioning into the adult services at 16 years old when I just left secondary school. I was getting quite anxious thinking about, what will the differences be? Basically just went away and just had a bit of a think about it and got asked if there was any questions or anything like that. And then gradually through, I think it was about 2 years, there was more talks about what the adult doctors were like and introducing them, and some of the adult team came into the paediatrics appointments.
There's a lot of benefits to introducing it early. It gives the patient enhanced support throughout the process, getting some guidance, answering questions and addressing concerns that they may have. That in turn reduces anxiety and stress to the patient, and not just the patient, their families as well.
I think it's really helpful to make a little list in advance of things that you are really important to you to understand. And that's the same between all the joint appointments, because it might be that things then crop up between the first and second appointment. You think, actually, I didn't ask this and I didn't ask that. And to have that idea in your head in advance about what your priorities are for that conversation, it's actually just to promote that independence in the young person.
The last appointment I had was in the paediatric service, and some of the adult team were there as well. And it was kind of saying a goodbye and thanking them for all they've done. I thought that there was going to be quite a big difference, but actually I found that there wasn't. You get made to feel really comfortable, and I feel like I can ask more questions because I'm older and I kind of have more of an understanding. It was just overall an amazing transition, especially for someone like me who is quite anxious.